Hello, dear friends. This video is about the preventive use of aspirin to avoid cardiovascular diseases and cancer, and, in general, to improve the quality of life. Aspirin is a representative of non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs block an enzyme called cyclooxygenase. Cyclooxygenase converts arachidonic acid, which is found in the membrane of our cells, except red blood cells. Arachidonic acid is converted into prostaglandins, thromboxane, and prostacyclin. In simple terms, there are two types of cyclooxygenase: cyclooxygenase 1 and cyclooxygenase 2. Aspirin acts on both of these types. Cyclooxygenase 1 produces protective prostaglandins that protect the gastric mucosa from damaging effects. Also, with the participation of this type of cyclooxygenase, a substance called thromboxane is formed. Thromboxane promotes platelet aggregation. Aggregation is the sticking together of platelets, red blood cells, into clumps. Blocking type 2 cyclooxygenase leads to a decrease in the production of pro-inflammatory prostaglandins, thus reducing inflammation. In this regard, aspirin is used as an antipyretic and pain reliever. However, the primary property that is of interest to cardiologists is the blocking of thromboxane production. If we reduce the production of thromboxane, we reduce the ability of platelets to stick together and thus reduce the risk of thrombosis, which is high in people with atherosclerotic lesions, with plaques on the arteries, as well as in people who have undergone cardiovascular surgery, such as stenting or aortocoronary bypass surgery or valve replacement. So for these people, low-dose aspirin is prescribed almost for life, and they need to take aspirin. Indications for cardiologic aspirin intake are as follows. It is prescribed to all people who have already suffered a heart attack or stroke. It is prescribed to people having valve replacement operations, stenting, and aortocoronary bypass surgery. Aspirin is also prescribed to people at high risk of cardiovascular disease, and these risks are assessed on a specific Framingham scale. I'll give you a link in the description of this video where you can calculate your own 10-year risk of cardiovascular disease. So, if the risk is above 10% and the person is between 50 and 70 years of age, you should take aspirin. I'll talk about other age ranges later. Also, people with diabetes should take aspirin if they have at least one risk factor, smoking or high blood pressure. It is recommended that women with diabetes take aspirin only from the age of 60 and men from the age of 50. Why are there age restrictions? Because there are side effects of taking aspirin, which I will discuss later. Before the age of 50 or after the age of 70, based on the available data, the side effects of aspirin are still higher than the potential benefits of its use. So that leaves us with this narrow age range, 50 to 70 years of age. I will also say that if a person has isolated diabetes mellitus without other risk factors, aspirin is not indicated. Another aspect of preventive aspirin intake relates to its ability to reduce the likelihood of cancer. In the year 2004, a review article was published that looked at the effect of aspirin in reducing certain cancers. The results were as follows. Aspirin reduced the development of esophageal cancer by 73%, and reduce the likelihood of stomach cancer by over 60%. It also reduces prostate, ovarian, and colon cancer. I mean, it seemed like a very promising review. They connected this property of aspirin with the fact that it has a weak inhibitory effect on type 2 cyclooxygenase, which, as I said, determines the production of pro-inflammatory prostaglandins. Thus, aspirin reduces the intensity of chronic inflammation processes in all organs and tissues of the body. Chronic inflammation is one of the hypothesized factors leading to the formation of cancer cells. Of course, such interesting properties of aspirin were picked up by people who promote the fight against old age. They started attributing to aspirin such properties as reducing the incidence of Alzheimer's disease, various bone fractures associated with osteoporosis, and reducing the risk of cardiovascular disease, precisely due to the suppression of inflammation. In general, they began to attribute the fight against old age to aspirin. As a result, to test this hypothesis, starting in year 2010, A large study was conducted in Australia and in the United States, which was called Aspirin. There were 19,000 participants in total. People received 100 milligrams of aspirin daily. Naturally, it was a double-blinded study. The doctors and the patients didn't know if it was a pill or a placebo. After the study in 2018, the data was published. It turned out that during 4.7 years of observation, people who received aspirin therapy showed no benefits. This group included people over the age of 70. There was no decrease in either dementia or age-related dementia in this group of people. There was also no decrease in the incidence of cancer, so no special effects of anti-aging were seen. But people taking aspirin were more likely to develop complications, such as bleeding, which I will discuss later. So, to date, as a result of this large-scale study, it has become clear that there is no clear evidence that aspirin can reduce the risk of cancer. However, what they have found is that aspirin does increase bleeding risks. Today, a second study is underway, tracking people taking aspirin over a long period. They're now looking at long-term outcomes. I'll leave links to that study in the description of this video, and you can examine the primary sources yourself. Let's talk about the side effects of aspirin. The most important one is aspirin's ability to cause bleeding. For one simple reason, decreased platelet aggregation will promote bleeding. Even the enteric soluble forms of aspirin, declared safe by manufacturers, are not always protective. When you take an aspirin tablet that dissolves in the intestine, it travels through the stomach, not irritating the wall, not forming ulcers, but being absorbed in the small intestine. In fact, the effect of aspirin is systemic, and absorbed aspirin will still inhibit the synthesis of protective prostaglandins in the stomach wall, which can result in ulcers. Sometimes it can even come to bleeding. Another feature of aspirin is its ability to cause allergies. Allergies can develop in the form of bronchial asthma, sometimes severe, because when aspirin blocks cyclooxygenase, it does not prevent the second enzyme, which is also produced in allergies, lipoxygenase. Lipoxygenase produces leukotrienes. Leukotrienes are substances that promote bronchial spasms and increase the manifestation of asthma. Thus, if a person with a predisposition to asthma takes aspirin or other non-steroidal anti-inflammatory drugs, all the arachidonic acid that could be distributed between the synthesis of prostaglandins and leukotrienes will be directed to the synthesis of leukotrienes. As a result, worsening of the bronchial asthma will occur. Therefore, when prescribing aspirin, one should always consider the drug's characteristic of being an allergen and its ability to cause bleeding. These properties of aspirin dictate two things. The first point is to consider the drugs that are used together. For example, if you need to take non-steroidal anti-inflammatory drugs to treat joint pain, such as ibuprofen, then you need to stop taking it or find alternatives so as not to worsen the possible negative effects of aspirin. If you're taking medications that affect blood clotting and are heparin derivatives, you must consult with your doctor to avoid fatal bleeding. These drugs include warfarin, clopidogrel, Pradaxa, and Xarelto. By the way, about bleeding, there can be bleeding of the gastrointestinal tract and hemorrhage into the brain, thus providing hemorrhagic stroke. In other words, we seem to try to protect ourselves from one ischemic stroke, but as a result, we can get a hemorrhagic stroke. It is necessary to be very strict about combining with various drugs and dietary supplements to avoid this. I will put the list of medications and biologically active additives that can negatively interact with aspirin in the description under this video. I will also say that omega-3 acids, which many people like to consume, can increase the risk of bleeding when combined with aspirin. Let's look at the second aspect to pay attention to. You cannot stop taking aspirin abruptly because the risk of thrombosis may increase many times. The ability of the platelets to aggregate may increase, and as a result, very unpleasant consequences may occur. To summarize, in terms of reducing cardiovascular disease risks, of course, aspirin works. Working dosages average 81 milligrams, but may range from 75 to 150 milligrams. Only the treating physician can determine the individual dosage and indications for aspirin prescription. It is not necessary to do this on your own. So far, there are no encouraging results regarding the anti-aging effect of aspirin and its anti-cancer effect. Therefore, I would hold off on using it, given that, after all, the drug is not safe. Thank you so much for watching. Take care, everyone. Always for you, Dr. PopMed.